Well, is that it always smells great as well. So never a bad idea to have. Hello, Dr. Joe here of the drjoe.com and the 2020from.com. Today, I want to talk to you about canker sores, also known as Arthur's ulcers in conventional medicine. And this has been provoked by a letter that I received recently from a gentleman. Let me read the letter out here for you. He says, "Hi, Dr. Joe. I've been having problems with canker sores for some time. My doctor is always prescribing me creams, which I believe have steroids in them, but they take a long time to work. Can you suggest anything natural that may help me with my problem?" Yes, I do actually, and in this video I'm going to give you three solutions that are scientifically backed and a bonus fourth one that hasn't got so much science behind it. So for those of you who are not familiar with what canker sores are, they're essentially, call them blisters, call them ulcers, call them sores that usually occur inside the mouth, okay, anywhere in the cavity. So you could have them on the lips, you could have them on the inner cheeks, you could have them on the gums, you could have them on your tongue, anywhere in the oral cavity. So the problem with them is they're very painful and because they are inflamed. So any treatment that is going to be effective has to be directed at the pain and the inflammation. And then of course the healing then follows. So these three remedies I've got for you, plus the fourth one, do have that potential. Now, if you are having, before I go into the substance of what I'm going to be talking about, if you're having recurrent canker sores, it may signify something else. So stress could be a factor. So, you may want to reduce stress in your life, and you could also be having nutritional deficiencies. So you may want to look into that. And a third cause could be immune disorders, because canker sores could be a herald to things like inflammatory bowel disease, like ulcerative colitis. So if you're having them in a recurrent manner, it will make sense for you to be investigated for any of those problems. So now that we're done with that, let's move on to the 3+1 remedies that I've got for you today. So the first one, you'll be surprised, a very simple one, is actually honey. Yes, honey. If there's anything honey is good for, is wound healing, and it does work for canker sores. So do I have any evidence of that? Of course I do. So I'm going to look at about 2 studies for honey. So the first study here was published in the Journal of Dentistry and Oral Hygiene, and is titled Effect of Honey for Treatment of Some Common Oral Lesions, a follow-up of 50 cases. Okay, so that's the first study. Now let's look at the study briefly. Now, it wasn't a big study, okay, and it wasn't randomized. So you could argue that scientifically it wasn't very deep because it wasn't randomized. But we'll look at the results anyway. The result says that there was pain resolution by day 1. So just 1 day of applying honey into the canker sore, there was pain resolution. Not bad. And there was complete ulcer healing by day 3 to day 4. That's a lot quicker than steroids. Okay, so that's one study there. Let's look at study number 2. Now, this study was published in Quintessence International, and is titled Efficacy of Honey in Comparison to Topical Corticosteroid for Treatment of Recurrent Minor Arthur's Ulceration, a randomized, blind, controlled, parallel, double-center clinical trial. Okay, so that's the study. We just take a quick look at what the study was about and their result. In this second study, this study was randomized. Okay, so it was randomized, and it's a bigger study. They had a bigger number of participants, and what they did was they compared honey with over-the-counter oral base, and topical steroids. Okay, so they split the participants up into those three groups. And what they found was that honey performed better in pain duration, ulcer healing, and inflammation. So honey was a winner above the steroid cream in that randomized control trial. Okay, not bad. So that's honey and the science behind it. So what's the second remedy? The second remedy I've got for you here is chamomile extract. Okay, chamomile extract also works for dealing with canker sores. Any science behind it? Well, we got something here, and this was published in the Journal of Drugs in Dermatology, and it's titled Clinical Evaluation of Fluid Extract of Chamomile recurrent for Oral Apathy. Okay, so that was the title. Let's take a brief look at the study and the result. So in this study, they had 82% of the participants had excellent pain relief. Okay, after 10 to 15 minutes. Okay, just between 10 to 15 minutes, 82% of the study participants had pain relief. Remember, I told you you want to target the pain and the inflammation. Okay, and that's because it worked that quickly, because chamomile does have anti-inflammatory properties. The downside to this study was that they didn't follow up the participants to see how quickly they healed. So they weren't followed up for healing. But there are anecdotal reports of quick healing when you use chamomile extract. Okay? So that is the second remedy. What's the third one? Well, the third one is lavender oil. Okay? Lavender oil. And any science behind it? Yes, we do have one here. And it's titled Topical Lavender Oil for the Treatment of Recurrent Aphthous Ulceration. Okay? But the aphthous ulceration is canker sore. That's just the medical name, aphthous ulcers. So let's look at the study in brief, along with the results. Now, this study here, they actually conducted the study both on animals and humans. Okay, so they had animals and humans, and it was a randomized controlled trial into lavender oil and placebo. So split the participants up into lavender oil and then placebo. And what they found was there was pain relief with just the first dose of the lavender oil. First dose, pain relief, pain gone. 90% had complete healing by day 3. Okay, it's pretty good compared to the steroid cream that would take about 7 to 10 days. And they also, the recommended dose to apply will be using the Q-tip about 3 times a day. Okay, so have I got any Q-tip here? So yeah, any cotton bud is all you need to apply any of this to where you had the ulcer, the sore. And like I said, any of these 3 remedies, okay, chamomile extract, honey, lavender oil, and the beauty of lavender oil is that it always smells great as well. So never a bad idea to have lavender oil around you. So those are the 3 main remedies. Now, the fourth one, I told you I had a fourth one for you. The fourth one is actually aloe vera gel. Okay, aloe vera gel. Now, I did look into the research to see whether I could find anything to support the use of aloe vera gel for canker sores, and I really couldn't find anything, very scientific. All I saw was just anecdotal reports. So there's a good chance that aloe vera gel will also work. And just use any cotton bud, okay, to apply it, just like with the other 3. So yeah, those are my substitutes for steroid creams for people who are having problems with canker sores, also known as aphthous ulcers. Hopefully you got some value from this video. If you did, please give the video a thumbs up. Please like the video, and please share this video with your friends, family, and colleagues. If you've used any of these remedies and it's worked for you, please do let me know in the comment section. And also, if you're someone who has problems with recurrent canker sores, also do let me know down below as well. I think that's about it. Until next time, well, this is Dr. Joe signing out.